If you're in Medicare sales and you're selling Medigap supplement plans, you have to watch this entire video. What I'm about to tell you right now is crucial to your success. I'm going to tell you why you should sell the Plan N, and if you're not, it's an absolute colossal mistake. If you're not selling it to your customers, send me your customers because I will sell them for you. Let's jump into this right now, but be sure to subscribe to this channel right now so that you can get really, really important content that'll help you in your sales process. So let me talk to you right now about where we're at right now in the Medigap Medicare supplement world. So right now, as you've probably seen, is that the Part B premium is now $170.10 starting in 2022. So they just jumped the Part B premium from $148.50 to $170.10. It just went up $21.60 a month. Your customers now are going to start feeling that pain. So let me kind of go back in time for you so that you can understand where we've been, where we're at, and where we're kind of going right now in the Medigap supplement world. So when I first started in the business over a decade ago, the most popular plan out there was the Plan F as in Frank. That was the most popular plan that people were buying. And then all of a sudden, the Plan G started to emerge as a great value because the only difference between the F and the G was just the Part B deductible. So starting this next year, again, here we go, the Part B deductible is going to $233 from $203. So it's going up. So here we've got two things that are going up quite a bit. You've got the Part B premium that's going from $148.50 to $170.10, and then you've got the Part B deductible that's going from $203 to $233. So that's going up $30 right now that somebody will be out of pocket on. So when back a decade ago, the Plan F was phenomenal. We used to call it the full coverage plan with Medicare. But the problem was this. The premium between the Plan F and the Plan G started to get bigger and bigger, where financially it didn't make any sense anymore to sell the Plan F. People were wasting money by buying the Plan F over the Plan G. If they decided to pay the Part B deductible themselves, instead of having the insurance company do it for them under the Plan F, it saved the individual a lot of money. So what I did, and where I separated myself from all the other salespeople that were selling, is that I would not sell the Plan F to anybody. It wasn't right for the customer. And that's the one thing as a salesperson, is you're always doing what's right for the other person, not for you, for the other person. So I was doing what was right for the other person. So I remember very vividly talking to a gentleman that was looking at the Plan F. And then I asked him, I said, hey, let me ask you, has anybody talked to you about the Plan G? He said, what's that? I knew right then and there that I was selling him. So we went ahead and we looked at the difference between the Plan F and the Plan G, and it turned out that he was a big wig as a financial advisor. And he said, Greg, nobody's actually even told me about this. He said, you're the first person that's told me about this. I signed both him and his wife up, and from that meeting, from that circumstance, he started referring me to all of his other financial advisors. To this day, I have 3 different financial firms in Texas that send me referrals and send our office referrals because I did the right thing for somebody many, many years ago. So let's talk about why things are now shifting exactly like they were a decade ago. So keep watching right now because I'm going to give you some bonus stuff that you're going to walk away with that's going to help you in the sales process. So here is one of the first takeaways. Stop selling the Plan G. If you're selling the Plan G, you're going to be making a big mistake. So now what's happened is it's flipped around. So now we've got the Plan G and the Plan N. Now those are the 2 plans that are now available to anybody that's going on to Medicare for the first time after 2020. So these are the only 2 options now that somebody has, is the Plan G or the Plan N. So you ready? Stop selling the Plan G. The Plan N is now the now plan for the future. That is the plan that now you should be selling to your customers. So let's look at apples to apples between the 2 plans. So under the Plan G, you have the Part B deductible of $233. You now have that deductible that you have to pay under Plan G. Under the Plan N, guess what? You have the same deductible as the 233. So now both plans are apples to apples, exactly the same. So when looking now at this Plan M, many years ago when people were looking at the G and the N, it didn't make any financial sense to ask somebody to buy the Plan N. Here's the reason why. The difference in premium between the two was typically only about $5. It was very, very minimal, and so there's really no reason to talk about the Plan N. The Plan G was the plan to help everybody out with. Now that premium has started to get much bigger, and it's starting to resemble exactly what it did a decade ago between the Plan F and the Plan G. So now let's talk about the differences between the G and the N. I told you I'm going to give you some bonus stuff here, so just keep watching. So we've got the Plan G and the Plan N, exactly the same. But there is a slight difference to it, and I'm going to show you exactly how to sell the Plan N right now over the Plan G. The Plan N has up to a $20 copay that is a discretionary copay that doctors can charge somebody that comes to see them for an office visit. I said the word discretionary, and the reason being is not every single doctor charges this $20 copay. They don't feel the need to do it. So for many people that are under the Plan N that go to the doctor several times, actually never even experience a $20 copay. I've talked to several of these individuals. I helped out a lady many years ago go from the Plan G to the Plan N, and at the end of the year I asked her, I said, let me ask you a question. You go to the doctor often this year? She goes, yes, I went, several times to the doctor's here. I said, has anybody charged you a $20 copay? She goes, yes, one did. One doctor charged her a $20 copay. So that's one of the big differences between the two, is under the Plan N, doctors can charge, what is it? A discretionary copay. And I'll tell you exactly how to sell that discretionary copay. So the $20 copay is a difference between the two. The other big difference is this, is that there's a $50 copay for an ER visit that does not result in an admission, okay? If somebody has to go into the hospital and they're admitted into the hospital, that $50 copay is waived. So here's my thing. You're not going to have a lot of individuals that are going to be running to the emergency room where that $50 copay is going to be a big, huge deal. Because if they're going to the emergency room, why are they doing that? They're doing it because it's a serious situation that hopefully is going to get them admitted into the hospital so they don't have to worry about that. But if they have to go in and it's in the emergency room, they're not admitted, they have a small $50 copay that they'll be responsible for. The last difference between the Plan G and the Plan N, this is where many years ago, salespeople started trying to scare their customers or their prospects out of buying the Plan N. You got to stick around because I'm going to show you this is an absolute non-issue. I'm going to tell you about it, but you never ever talk to a customer about this. And I'm going to tell you exactly why. If you stick on long enough, I'm going to tell you why this should never ever come out of your mouth. The next thing that is the difference, so we've got 1, 2, and we've got 3, is something called excess charges. Is the difference. And again, remember, this is where salespeople have scared their clients, scared their prospects into not buying the Plan N, and it's because they were misinformed. You're going to walk away from this video right now and you're going to be someone that's not going to be misinformed about the excess charges. And when it comes up, if it does, you're going to know exactly how to respond to that exact thing. So before I talk to you about the Plan N and the Plan G and talk to you about these three things, because I'm going to keep you on your toes, let's look at a couple of differences right now between the Plan G and the Plan N. I've got stuff right here to show you. So right now I'm looking at zip code 44314, which is in Akron, Ohio. So in Akron, Ohio, for somebody that's 65 years old, the Plan G would be $114.96. It's one of the best carriers out there, one of the lowest rates out there, would be $114.96. The Plan N, on the other hand, is $89.49. So the difference between these two is $25.47 a month. Somebody's saving $25.47 a month by going from the Plan G to the Plan N when they're going on to Medicare at 65 years old in Akron, Ohio. So here is my bonus tip for you. Here I'm going to show you how to sell this. That $25.47 over the course of an entire year is $305.64. What does that equate to? If every doctor they went to charged a $20 copay, you ready for this? They would have to go to the doctor 15 times in 1 year, and every single doctor charged them a $20 copay just to equal what they would have paid under the Plan G. So again, 15 times a year, they have to go to the doctor before they actually are equal in price to what they would have paid on the Plan G. I'm not stopping there. Here's another bonus for you. In order for a doctor to charge the $20 copay, you ready? In order for them to charge a $20 copay, the individual first has to have met the $233 deductible. So guess what? If somebody hasn't met the $233 deductible yet, a doctor cannot charge the $20 copay. So it's even more than just the 15 times. We're just going to keep it at 15 times a year. Somebody has to go to the doctor. So let me ask you this. What looks better for you? What looks better for your customer? $89.49 or $114.96? And keep in mind, government just raised the Part B premium to $170.10. So it went up $21.60. So that's in Akron, Ohio for a 65-year-old. Let's not stop there. Let's go to Ocean City, Maryland, 21842. And let's go to a 67-year-old female. So not 65, let's go to 67. So in this area, one of the best companies out there, the Plan G is $130.02 a month. The Plan N is $95.42 a month for the plan. So that's a difference, ready? $34.60 a month. So that individual, instead of getting the Plan G, they get the Plan at $95. It's under $100 a month, which is a good selling tool, but it's also $34.60 a month. So in this case, oh, it's even more. This person has to go 21 times a year to a doctor in order to go ahead and make up the difference in the monthly premium over the course of the year. Are you seeing where this is going right now? Financially, it doesn't make sense for anybody to buy the Plan G anymore. The Plan G is gone. Think of the G as gone. The N is now the now plan for the future. So if you're not selling the Plan N, you got to keep listening, because I'm going to give you some more tips right now on exactly what to do and how to address some of these copays and the excess charge. So let's move on right now to Tennessee. We're going to go to 37143 in Tennessee. It's in Tennessee, and we're looking at a 69-year-old male. So now we're looking at a 69-year-old male. So one of the best companies out there, the Plan G is $116.03. The Plan N is $87.46 a month. Get out of town. $116.03 versus $87.46 for the Plan N. So that is a difference of $28.57 a month. So now this gentleman at 69 years old has to go to a doctor 17 times in 1 year just to make up the difference between 87 and 116. You're not convinced yet? Let's keep going. Let's keep going, because this pattern continues to play itself out every single time. So if you're selling the Plan G, you're going to be gone as a salesperson, because guess what? My sales agents are going to come in and they're going to sell your customers on the Plan N because it's the right thing for your customer. It's the right thing for your client. So right now, I'm in Kentucky, zip code 41041. So 41041, we're going to look at a 66-year-old male. So right now, the Plan G for him is $125.47 a month. $125.47. The Plan N is $100 $25.43. So that is now a difference of $25.04 a month. So again, here we go. 15 times a year, that individual would have to go to a doctor, and each one of those doctors charged him a copay just to equal out the $125.47 that he would have paid under the Plan G. So we're going to go to Mississippi right now, 39208. So I pulled up a lot of different variables here. So this is a 65-year-old female in Mississippi. It's $90.97 a month. So it might be attractive for somebody to sell this individual a Plan G because it's $90.97 a month. But you're doing a disservice to your customer. The Plan N, are you ready for this? $69.27 a month. What's better for your customer? $90.97 or $69.27. So that is a difference of $21.70 a month. Almost the difference right now in the Part B premium is $21.60. $21.70 a month. That is now 13 times a year that individual would have to go to a doctor, and each doctor charge them the discretionary $20 copay. So we're going to go to Texas. We're going to go to the last one right now. This is a 72-year-old female in the state of Texas in zip code 75103. The Plan N is Plan G is 121.01. The Plan N, you ready? 121.01. The Plan N is $94.83. So here we've got a difference now of $26.18 a month, which equals out to 16 times 16 doctor visits that individual would have to go to, and each one of those doctors charging a $20 copay just to go ahead and make up the difference in monthly premium. So I told you I'm going to show you exactly how to sell the Plan N. So if you're watching right now, kudos to you because you stuck around long enough to not only see the difference, but also now let's talk about how to sell the Plan N. So when you're talking to somebody about the Plan N, you're talking about the $233 deductible, you have to talk about that in every single phone call. You have to talk about this $20 copay that doctors can charge. So here's how you talk about the $20 copay. You tell the individual this, is that the Plan N was now the Now Plan so that individuals are not misusing and abusing the healthcare system. So when somebody has to go to a doctor because they are a hypochondriac, it's now going ahead and it's keeping those individuals from doing that because they have to think about a $20 copay before they do that. First of all, the $233 deductible has to be paid first before the $20 discretionary copay ever is charged. Remember, preventative visits are what? They are covered by Medicare at 100%. So if somebody has to go to a doctor, they could be charged up to a $20 copay, but again, it's there in place by the federal government in order to prevent misuse and overuse of the healthcare system. So that's how you sell it to your client, to your customers, that, hey, you're doing a good thing right now, is that you're getting into a plan that's going to stay stable, the premiums are going to stay lower, because you are making sure that you're not misusing or abusing the healthcare system by going to the doctor for things that aren't medically necessary. So you sell the Plan N, the $20 copay, as only something that you're using that's medically necessary, and you're actually doing a good thing for the healthcare system. So that's how you sell the $20 copay. And again, it's not a big deal. Why? Because there's such a huge difference in monthly premium and how many times they would have to go to the doctor during the calendar year, and every single one of those doctors have to charge a $20 copay. And guess what? You're going to have preventative visits in there that aren't going to have any cost at all. You're going to have the $233 deductible that has to be paid first. So this discretionary $20 copay is no big deal. So again, the Plan N is the Now Plan. The $20 copay is no big deal. See how I'm playing on words? N, now, N, no big deal, G is gone. Use a play on words in order to sell your customers. So $20 copay, no big deal. Secondly, the $50 copay, no big deal. You sell it to your customer like this. Hey, with the other plans, other Medigap plans, somebody could run to the emergency room for a sunburn because they weren't concerned about it because it wasn't going to cost them anything under the other plan. So now people are misusing and overabusing the plan G, the plan F. So now under the plan N, somebody's only going to the ER if it's medically necessary and they've got a major problem and they're not misusing or overusing and abusing the healthcare system. So again, you're doing this as a positive thing for that individual, that the $20 copay is there so that it's not misused, it's not abused, and in turn, the companies are going to reward you. They're going to give you a lower monthly premium, and they're going to keep these rates very, very stable. And I can tell you, I've watched this Plan N over the last several years, and the Plan N, the premiums have stayed very stable and very level because people are not misusing and they're not over abusing it. The Plan G premiums, guess what, are starting to go up and skyrocket just like the Plan F was. So stay away from the gone plan, stay away from the Plan G. It's now the N is the new G. So again, remember, playing on words, the N is the new plan to the Plan G. Last thing, excess charges. Here's my tip. I told you stay long enough. I'm going to give you a tip right now. You don't talk about excess charges. They're not relevant anymore. I'm going to explain to you excess charges so that you understand them, so that if it comes up with a client, you know exactly how to deflect, because it is no big deal. Here's excess charges so that you understand them. Excess charges are for doctors that do not accept Medicare's assignment, which means that doctors do not agree with Medicare's pricing. So they accept Medicare, but they don't accept Medicare's pricing, okay? Here's the deal. Over 97%. 97% of doctors accept Medicare's assignment. That 3% is so small, and they're usually doctors that do alternative medicine or very, very expensive specialists, but you're looking at less than 3% of doctors don't accept Medicare's assignment, and they will not charge excess charges. So that's the first key thing. Second thing is this. Told you to hold on. Second thing is this. Let's say that they see the 3%. One of your clients sees the 3%. That doctor has to tell the individual that they do not accept Medicare's assignment, that they charge excess charges. Okay? Here's what the federal government does to that less than 3% that does not accept Medicare's assignment, and they charge excess charges. The federal government allows somebody in this 3% really small world to charge 15% more than what Medicare allows for that doctor visit. So if I'm in that 3%, under that 3%, that accepts Medicare, but I don't accept Medicare's assignment, I don't like the fact that Medicare is only going to charge me is only going to pay me $100 for my doctor visit. I want to charge 15% more. I want to charge $115 is the max that I can charge. Well, the government's going to say, okay, you don't accept our pricing. You don't accept the fact that we're going to give you guaranteed money. We're going to slap you on the wrist. We're only going to pay you 95% of what we would have paid you. So here's the deal. We're not going to give you $100 now. We're going to give you $95. So they're going to go ahead and they're going to slap them on the wrist, and they're only going to pay them 95%, not the 100%. So now that doctor is out trying to go ahead and get the excess charge. They're now trying to be a bill collector for, guess what, not 15% anymore, only 10%. Because guess what, the government's now holding back 5%. So financially, it doesn't even make any sense for a doctor to charge an excess charge. So it's a moot point. Bringing up excess charges is a moot point because you've got doctors less than 3% that are charging it. They're slapped on the wrist if they do it by 5%. And so now going forward, when you bring up excess charges to your prospects or your client, you're just confusing them. You're confusing them on something that the likelihood is so very, very small that it'll ever happen. And guess what? If it does happen, you're okay. And here's why. Aetna came out in 2016, August 2016, and they said that of all the claims that they received, remember, under F and under G, these are the only two plans that if somebody bought them, the excess charges were covered at 100%. So anybody with Aetna that has the F or the G plan, Aetna or any company out there is now responsible for those excess charges. So they reported in 2016 that of all the claims that they got under this Plan N, under the Now plan, 99.34% had no excess charges to them at all. So that left less than 1%, almost half of a percent. It left 0.066% of claims that they received that they had to pay an excess charge. Okay? And here's the beauty. You stuck around long enough, here is your takeaway. For that 0.5% that you're going to confuse somebody by bringing up the excess charge, or for that less than 0.5%, Aetna reported that it was less than $20. Don't talk about the excess charges. It's so rare, and at the end of the day, it's less than $20, so it looks like a what? A copay. Looks like a $20 copay. The individual wouldn't even realize probably that it was even an excess charge that was charged to them. But let me kind of go back a second. You remember what I just said when Aetna reported this? This was in 2016. We are now going into 2022. Excess charges are becoming even more less relevant. So don't even have to bring it up. But if you have a client out there that thinks they know everything, you now are armed exactly with the information on the right way to explain to them so that you understand it. So watch this video again so this really sinks in your mind as far as what you're doing to help out your clients. Because if you're not doing it, somebody else will. Somebody else will come in and they will sell them the Plan N and do the right thing for that customer, or somebody's going to come and they're going to sell them a Medicare Advantage plan because the Plan G pricing is going up too much for them that they can't financially afford it anymore. So get them in a plan that's under $100. That's the Now plan to Medicare that at the end of the day is going to save them a lot of money, not just now, but over the course of time. But at the end of the day, you are doing the right thing for your client. So in our office, we don't even ever talk about the Plan G. We only talk about the Now plan, the N plan, because that is the right thing for that individual, and it's going to save them not just money now, but it's going to help them for the future. So last little tidbit, I told you to hold on. Here's the bonus. There's 8 states where you can't even charge an excess charge. It's illegal to charge an excess charge. Those 8 states are Connecticut, Massachusetts, Minnesota, New York, Ohio. That's a big place for Medigap sub-plans. We operate a lot in Ohio. In Ohio, it's illegal to even charge an excess charge, so you can't even charge it in Ohio. Another big state that we do a lot of business in is Pennsylvania. In Pennsylvania, it's illegal for doctors to charge excess charges. So again, Ohio and Pennsylvania, which are 2 big Medigap supplement states, the excess charges are a moot point. It's not even relevant. And then the last couple of states is Rhode Island and Vermont. So those are the 8 states that it's illegal to even charge an excess charge in there. So when you're talking to your client, when you're talking to your prospect, here's how you sell the Plan N. There's a $233 deductible that you're responsible for any medical expenses. Once that $233 deductible has been satisfied or met, that first has to be met, all of your preventive visits are covered at 100%. Doctors have a discretionary $20 copay that they can charge for things that are medically necessary that will keep costs down so that the healthcare system is not abused and overused, and hypochondriacs are not showing up to the doctor's offices and wasting their time. There's a $20 copay for medically necessary doctor visits. That's how you sell the Plan N on the copay. The $50 copay on the ER visit, again, that is really a non-discussion, but you really have to talk about it, is that it's only for emergency room visits that do not result in an admission. So if they're admitted to the hospital, that $50 copay is waived. Again, you're explaining the $50 copay as a good thing so that the hospitals and the emergency rooms are not overwhelmed and that is not being misused and abused by somebody that's on Medicare. So now that you understand that we're no longer selling the G plan, it's the Gone plan. We're now selling the Plan N, it's the Now plan. Now that you have this information, go out there and be an absolute sales rock star to your prospects, to your customers, and do the right thing for them by selling the Plan N. I'll see you soon.